It's a show where we talk about mental health and suicide prevention. Set a reminder for that. And just before I go, I want to let you know I care about your mental health. And you know what? Stick around right here on this station. Don't go nowhere.
It's another Friday, and you know what time it is, and you know what show you're on to on MZ Radio London and AP Radio UK. It's the MHAASP show with KP. Yes, that's the show where we talk about mental health and suicide prevention. Thank you for joining me once again on the show. I must appreciate you for doing that. And like I say every week, if you have somebody who is not yet on the show, who is not yet live with us on the show, just go ahead and tell that person that, hey, the MHAASP show is on already. You know, come on and let's have another wonderful time together on the show. Yes. My name is Kunle Pelemo. They call me KP. Yeah. And you know, whenever I'm in the building with you right now, oh, you know how we say it. KP in the building. Oh, yes. Yeah, it's been a lovely week, and thank God it's Friday. I know a whole lot of people are somewhere celebrating the TGIF. Yeah, it's a good way to unwind. Yeah, play a good song. And then just as you are with us right now, that's another wonderful way to also have a good time listening to a show that will help you. Also, we sensitize you about your mental health, you know. So it's a wonderful thing. Thank God it's Friday. I'll be with you alone on the show today. I've got no guests with me, but trust me, maybe next week we definitely will do that. Yeah. And yeah, looking at the situation of things and looking at how we reach out to people on this show. I mean, we have the capacity of reaching people considering the medium through which we hear this show. And then on and this radio stations, I mean, MZ Radio London, AP Radio UK, you know, we can get to any part of the world, either live or through other means. We can reproduce this cast to reach. So, and we also need to all be in tune with what's happening in our world, most especially during this challenging time that the world is experiencing. I understand that a whole lot is happening in India currently as regards the rebound of the COVID-19 pandemic. I don't know what wave it is, maybe the third wave or second wave or whatever, but a whole lot of people are just holding on by the skin of their teeth because the effect is much. The mental health of people right there also is paramount. So we're going to reach out to people in India and we know the state of things and then and how we could also support their mental health on this show. And possibly we have a guest that will be from India maybe next week on the show, because what we're doing is to create an awareness about mental health globally and also create a zero suicide society globally as well. It's the MHAASP show on MZ Radio London and AP Radio UK. What are we discussing on the show today? Today, we're talking about maternal mental health. Maternal mental health. I can remember on May 5th, it was declared the World Maternal Mental Health Day. And yeah, I feel, okay, let's just bring you to the show and discuss something that has to do with that. And so, for the next couple of minutes that I'll be with you, that's what we will be discussing. And yeah, it's an important topic because women who are pregnant for the first time will likely spend most of their pregnancy learning how to care for their baby. But what about learning how to care for themselves? I mean, this was what somebody said, and I really love how she puts it. You know, when women are pregnant, they're concerned about, you know, their baby, how to take care of the baby, but somehow, what about learning how to care for themselves? And one of those things that really affect women, either um, prior to childbirth or maybe between childbirth and 1 year after childbirth, is some mental illness that come around. But sometimes most women are not aware, and they don't even know of such things. And that's why we want to just create an awareness about that and let people know some things that are supposed to be known in that regard. Maternal mental illness is mental illness that occurs during pregnancy or in the first year after childbirth. It is said that 1 in 5 new mothers experience perinatal mood or anxiety disorder. And it's also said that 1 in 1,000 experience postpartum psychosis. That's a case where a mother could hurt herself and a baby. The ratio is very, very small, but it's still something that needs to be discussed. Maternal mental health issues include postpartum depression, postpartum anxiety, postpartum trauma, and all the likes, and that is why we need to talk about it. A whole lot of people, after giving birth, they fall into depression and they don't even know how it happened. And some are having anxiety, some are having trauma, as a result of maybe past experience or the experience they had during childbirth, and that does not only have effect on the mother, but the child as well. According to the World Health Organization, worldwide, about 10% of pregnant women and 13% of women who have just given birth experience a mental disorder, primarily depression. In developing country, this is even higher. It's about 15.6% during pregnancy and 19.8% after childbirth. In severe cases, mothers' suffering might be so severe that they may even attempt to take their lives. In addition, the affected mothers cannot function properly. As a result, the children's growth and development may be negatively affected as well. Maternal mental disorders are treatable. So that is like a good news. And how do we start that? We should do that as effective intervention can be delivered even by well-trained non-specialist health provider. So it has to be something that is done early. That is, there must be an early intervention. Research has indicated that risk factors for poor mental health during pregnancy include past personal or family history of psychiatric illness or substance abuse, past personal history of sexual, physical, or emotional abuse, current exposure to intimate partner violence or coercion, current social adversity, and coincidental adverse life events. Psychological disturbances during pregnancy are associated with inadequate antenatal care, low birth weight, and preterm delivery. While in postpartum, it is associated with diminished emotional involvement, neglect, and hostility towards newborn. Studies have indicated that the prevalence of antenatal depression and or anxiety ranges from 8 to 30%. And you know what? An organized knowledge about this crucial aspect of mental health is not only helpful for the mother, but for the child as well. And that is why we're creating the awareness on the show today. Some mothers will just notice that immediately after childbirth, they are having low energy, and they're having also, some kind of symptoms that has to do with depression, low interest even in the child, and somehow they don't want to speak up because they feel maybe it's strange, and that will definitely continue to aggravate the problem, because if it's not treated, if there is no intervention, definitely it will worsen the case. And like I keep repeating right now, it not only will affect the mother, but the baby also. So once you notice that either pre or postpartum, it's important that you seek early intervention. It's important you seek early treatment so that it will not degenerate into something more devastating. So how do we now help people who are in these related issues, who are having either postpartum or pre or anything that is perinatal mental health problem, as we have elucidated further? We will talk about that when we come back from this musical break. This is Anywhere by Ophil. Stick around and go nowhere.
Yeah, Ophil's. All 3 beats. I can't live without you. I can't do without you. Bí mo ṣe ń lọ máa bá mi lọ. Bí mo ṣe ń lọ máa bá mi lọ. Bí mo ṣe ń lọ máa bá mi lọ. Bí mo ṣe ń lọ máa. Anywhere I go, 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 please follow me, go. Hey. Anywhere I go, 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 don't leave me alone, my love. Anywhere I go, 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 please follow me, go. Hey. Anywhere I go, 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 don't leave me alone, my love. Anywhere I go, 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 please follow me, go. Hey. Anywhere I go, 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 don't leave me alone, my love. Anywhere I go, mama pariwo, I let the world know you. Mama like go because you came and set me free. I'm free indeed, on solid rock, that's where I'm standing. If no be for your word in my life, what would I've been saying right now? Now, no more struggling, no more hustling, no more wrestling, new mentality. I can't live without you. Oh, hey. I can't do without you. Yeah, I cannot breathe without you, Lord. Oh, hey. I can't go without your word. Hey. Anywhere.
Station on the Hill, MZ Radio London.
Station on the Hill, MZ Radio London. Station with distinction, AP Radio UK. Yeah, and that's where you're logged on to. And this is the MHAASP show with KP. And we're discussing maternal mental health, trying to create awareness about the mental health of our mothers prior to childbirth, and maybe 1 year are those things that really are not illnesses or mental disorders that they experience. Some of them don't even know that such things exist. And that's one of the things that I have highlighted here that can be done in order to help our mothers or mothers to be. The first thing is awareness, and that's what we do on this show. So many women don't even have an idea of what perinatal mental health care is. They feel they're alone whenever they are having such issues. That how could you have a newborn baby that you're supposed to love, and somehow you're having low interest in the baby? And that might be as a result of what you felt sometimes ago, or as a result of low moods that you have. So they find it difficult to speak up as regards that. And the more they hold it together or they bottle it, the worse the case will grow. So that's why it's important to let them know that there are issues like that, whether during signs of panicking and anxiety, and it might be due to so many factors that I have highlighted earlier on. It might be a form of, as a result of either physical or emotional or verbal abuse, or maybe violence during pregnancy or even childbirth, and such things will definitely affect the mother, which can also be transferred to the baby if not well taken care of. So awareness is first thing that I highlighted here that must be taken into cognizance, so that women will know that they are not alone. Other women feel the same way too. There are several women who also, feel the same way. Look at the statistics that I said earlier on, that 1 in 5 among new mothers will have perinatal issues. So 1 in 5. So if there are other people who are feeling such things, so you need to just speak up to professionals who can help you, so it will not aggravate the problem. That's number 1, awareness. 2, women should also have access to quality and affordable mental health care during and after childbirth. Our healthcare institutions should be strengthened. So this is very important, that even prior to childbirth, there must be an organized approach to making women, know that there is something like this, and then they need a health care for it somehow. So mental health during pregnancy and even after childbirth is very, very important. So women should not be denied the access to quality and affordable. It must be quality, and then it must be affordable. Then the next one, healthcare some mental health self-care practices during their antenatal visit. So when mothers come, or mothers' health care institutions, in the hospital, in the clinic, you can also that they can do themselves while at home to help them boost their mental health during that period. That is very, very helpful, and it's very important. And then the last one that I have here before we call it a day on the show is support. There must be support from the husband, family members, friends during pregnancy and then after childbirth. And pressures that might arise as a result of multitasking, that's by the mother now, should be totally avoided. So as family members, when we see that one of us is pregnant, that's the women in the house, if they're pregnant, there must be adequate support for them. Psychological support, emotional support, moral support, and even physical support as well. And as a father, you don't need to task the mother the more during that period. Gone are those days whereby you still leave the mother to keep doing more than she could. As a father or as a husband, you're there to help. So try as much as possible to grant and give her the support necessary so that it will not affect our mental health during pregnancy or even after childbirth. And as a mother now, it's important that you also take care of yourself so that you can take care of the baby. As the saying goes, you can't pour from an empty cup. So as a mother, take care of yourself so you can take care of the baby. And if you do that, I'm sure definitely your mental health during pregnancy and after childbirth will be well looked after. Thank you so much. That's all I have for you on the show today. And I'm sure you've gotten one thing or the other for yourself or for somebody that you can also share the message we have today with. I want to specifically thank my producers, Mr. Soji Amini on MZ Radio London and O'Fields on AP Radio UK. Thanks as always. Thank you so much. The next week that we see, remember I normally say, stay mentally